So masks don't work. When I say masks don't work, I mean they don't keep you from getting a cold or a flu or a coronavirus. They don't do anything. And here's Dr. John Campbell to tell you.
Well, welcome to today's talk. And it turns out that these masks we wore for such a long time are actually completely useless, as indeed are these paper ones that we also wore for a long time. So they don't seem to do anything at all, according to the data. And as well as that, they make your glasses steam up. Now, welcome. It's Thursday, the 2nd of March, 2023 today. Now, I want to apologise for advocating for the use of masks for pretty well all of the end of 2020 and pretty well all of 2021. We changed our position on this channel on the 19th of February 2022. So for advocating masks before that, my apologies, I was wrong, or at least it's certainly not supported by the data. So let's look at the author's conclusions of this study here. I just want to read these out. This is about the Cochrane review, I will show you in a minute. The pooled results of randomised controlled trials did not show a clear reduction in respiratory viral infections with the use of medical surgical masks. There were no clear differences between the use of medical surgical masks compared to the N95P2 masks either. In these respirators.
So what he just said, and what we've already reported on this show, is that there was no difference in regular surgical masks or those N95 masks. There was no real world difference in you contracting a virus, a flu virus or a coronavirus. That's what he just said. There was no real world difference. Okay.
Healthcare workers made essentially no difference when used in routine care to reduce the spread of viral infection. So there we go. That is the author's conclusion. This is the paper here, and it is a very comprehensive Cochrane review.
So now the Cochrane review is the gold standard, and the guy who did this is also one of the leading guys who does stuff like this. And I know this because I saw another report by another guy who's a smarty pants who told me all this stuff. And so this is the creme de la creme of randomized controlled studies that you're supposed to do. And the conclusions is masks don't work in the real world. Okay.
Wow.
Freely.
What?
Guess we just dump them in the ocean.
Very comprehensive piece of work. There's a plain language summary, there's an ordinary abstract.
So there's
a huge amount of detail there, citing in great detail.
So this is an amazing study. They did unbelievable detail. Again, they did it the way you're supposed to, and their conclusion was masks don't do anything.
All of the literature. It's a pretty well a day's work to read it, actually, but it's all there. So what is it telling us and why we were wrong? I'll come to that. Winston was wrong as well, but he only does what I tell him, so it's not his fault. All that time, and they weren't really doing anything at all.
All that time? They weren't doing anything at all.
YouTube allows me to apologise for advocating mask wearing because it doesn't have a particular policy about mask wearing. Anyway, do physical measures such as hand washing or wearing masks slow down the spread of respiratory viruses. Now, today we're not going to do hand washing. We're just going to look at the masks. We might look at hand washing, which does have some efficacy, but the mask wearing doesn't. Evidence published up to October 2022. So, reasonably up to date. Now, the background here is that previous work on the 2009 H1N1. They'd done work on SARS coronavirus 1 in 2003, the COVID pandemic, of course, updated the Cochrane review that was last published in 2020 with all the latest data. So this is as up to date as we get, and this is as definitive as we can be as we speak now on Thursday, the 2nd of March.
As definitive as you can be. This study is definitive as you can be, and
2023. Main results, 11 randomized controlled trials and cluster randomized controlled trials. Now, a cluster randomized controlled trial just means instead of taking individuals in a trial, they take groups, so a group of people who wore masks and a group of people who didn't wear masks. Perfectly legitimate, well-recognized research method. 78 randomized controlled trials. Now, first of all, the data on medical surgical masks compared to no masks. Wearing masks in the community probably makes little or no difference to the outcomes of influenza-like illness. Wearing a mask may make little or no difference to how many people caught a flu-like illness, according to the plain language summary. So, does wearing masks protect us in the community against becoming infected with COVID and influenza? No, not really, according to this.
No. So the answer is no.
Not even the 95 one.
No.
The N95.
No.
None of them.
No, they said that because the way you wear them, it doesn't... If you in a laboratory, yes, the N95, but if you in real world, people don't wear them correctly. People touch their face, then they get stuff on their fingers and they touch their mask, and then they're breathing it in through their mask all day, and that's even worse. And plus, nobody fits it right. And the data is it doesn't slow. It didn't work. That an N95 didn't make any difference in a regular surgical mask, which also made almost no difference. So these things don't do anything, and you're all going to get COVID. This idea that you can go through life and somehow, I love people who go, I've been wearing masks for 3 years and I haven't had it. Nobody in my house has had it. Yes, you have. You've probably been asymptomatic and you probably have. And you're not going to be able to not get it. Do you think you're going to be able to go through your life without getting a cold? Because you're not.
I think some people now think they're going to be able to not get other stuff.
Yeah, well, we're going to get to it. So here's the paper, but now why do I bring all this up? I bring this up because the Washington Post won't let go. I know people personally that won't let go. They like to look down their nose at Trumpers for being anti-science, and they cling to this mask stuff. I
know people that don't even like the vaccine as much as I love it, who also, they just like they just think they're keeping viruses out. This is when I went to China. It was like here. Mm-hmm. Everybody thinks China's different. It's not. Few people will always wear masks there forever. Right. From back when bird flu came out. I was like, that's weird. And sure enough, we got it here. You can't. Everyone's going to get COVID and coronavirus. There's no getting out of it. Okay. So what you should be doing is get ready for it. You should lose weight. You should get in shape. You should take vitamin D3. You should take zinc. You should get a couple of other things ready that YouTube won't let me say. Get your cat some vitamin D too, because I assume I'm not telling you to take ivermectin. That is not what I'm saying. So here they are. They keep clinging to this. You see these people on Twitter that keep clinging to this. Yeah, upper class. It's sad. They got Howie Mandel syndrome. It's sad. It's sad. And then I tell them what the science is on masks. They dismiss it, and then they get angry at me personally. And there's a saying that it's easier for someone to forgive you for being wrong than it is to forgive you for being right. And so now I've created a lot of these enemies that used to be my friends because I got COVID right and they got it wrong. They could forgive me if I was actually wrong, like I can forgive them. Right. But they won't forgive me because I was right. That's the meanest thing there is. That's the meanest thing you could do, is be right about masks. And people who are small, petty people who don't have a lot of character can't admit they're wrong about masks or anything to do with COVID. And then there are even smaller people when they lash out and try to discredit or smear me when I'm correct. No. So that's I get that you lack character. You don't have much of a spine and you can't admit when you're wrong, but I wish you would. If I wear a full electric air purifier around my neck, that still works. That still works. The Cochrane database of systematic reviews, this is from the Washington Post, a respectable biomedical journey, the most respected, surprised the public recently with a peer-reviewed article. No, it didn't. It didn't surprise the public. We've known this since the start. Raising doubts about the effectiveness of wearing masks and respirators during the pandemic. The author of the study, Tom Jefferson, of the University of Oxford, one of the most respectable guys to do this in the world. He declared that face masks in an interview, there is just no evidence that they make any difference. Full stop. Whoa. There is no evidence that masks stop the transmission or contraction of a flu virus or a coronavirus or a cold virus. Doesn't do it. You know, I guess what he's saying is Fauci was right the first time. Yes. The whole thing he was saying was correct. So then they go like this. Watch this. They go, not so fast. This is the Washington Post. Not so fast. First, definitions. A face mask or surgical face mask has gaps at the sides, and the filter materials vary widely, so they do not provide full protection. Okay, that's just a non-paragraph. That's no new information. Everyone knows this. Wait, what's a face mask? I'd like to see the definition of it. Why do you have to define a face mask? That's a face mask, and then a surgical mask might prevent droplets from reaching the nose or mouth, but it cannot protect well against smaller airborne particles, meaning a virus. What about a hockey mask? I thought, not so fast. I thought we're moving at the speed of science. No, we're moving at the speed of Taylor Lorenz's hopes and fears and dreams. That's right.
Respirators such as the N95 have a tight fit against the face and far more efficient filtration that can stop smaller particles, so they are far more protective. They're just saying words. When the COVID-19 pandemic began, it was feared the virus spread in larger droplets when people cough, sneeze, or sang in a choir.
And now it's not.
This was the reasoning behind social distancing. By the way, no science behind that.
Yeah, the science, I think they said they're 10 feet, and business leaders bargained it down to 6 feet.
They just made it up. That 6 feet thing, no science, no study, no nothing. They just pulled it out of their ass.
It does make you nervous. See, the mask mandate and the standing in line, it does help make you afraid, so you're more likely to get the great vaccine. So some good did come. So
some good.
Yeah.
Going back. But we now know that COVID particles can be much smaller and hover in the air for an hour or more. Through gaps in a surgical mask, they can reach the nose and mouth, but a respirator is more likely to stop them from being breathed in or out, even though the study showed it doesn't make a difference. I just want this to be true. That's who fucking wrote this.
It's the editorial staff.
The editorial board of the Washington Post. Yeah. That's not even a person.
Nope.
So they're the most anti-science. Everything they've said about Trumpers is true of the Washington Post editorial board. These are the same people who told you were an idiot if you didn't think Iraq had weapons of mass destruction. Same people. The science is in, and they're going against science. Why? Just because they want it to be. But a respirator is more likely to stop them from being breathed in or out. Is it more likely to stop you from catching COVID? No. Dr. Jefferson and his colleagues set out to measure using a mountain of data, which is what you're supposed to do, whether physical methods. Am I out of my mind, or did they try to make that seem negative?
I don't understand the whole. This is like one of them things where they're. Remember you saying that thing that made you think it was a lab leak, trying to debunk the lab leak?
Yeah.
That's what this reads like.
Yeah.
Like, no, it does help, and they tell you why it doesn't help.
But there's no. So the new report. So making hand washing. So let me read this again. Dr. Jefferson and his colleagues set out to measure using a mountain of data.
Maybe it was too much data for them.
It sounds like they want to make you think they use too much data. Whether physical methods such as masks and hand washing can interrupt or reduce the spread of respiratory viruses. The new report is an update to an earlier review of scientific research, drawing data from 78 different studies, including 11 new randomized controlled trials involving 610,000 frickin' people.
Wow, that's way more people than the "Is it okay to be white?" survey
that it's more
off Scott Adams, which is about 1,000 people.
Looking at all the data, the researchers expressed doubt about the effectiveness of face masks and respirators. Compared with no mask, wearing a mask may make little to no difference in how many people caught a flu-like illness or COVID-like illness, and probably makes little or no difference in how many people have flu or COVID confirmed by a laboratory test. That's the science. That's what the science shows. But the editorial board of the Washington Post is just going to make up some other science.
They're low confidence with it.
Moreover, they said, compared with wearing face masks, wearing respirators probably makes little to no difference in how many people get the flu or a respiratory illness. Dr. Jefferson did not answer our request for comment, as he shouldn't. He did his study. It's peer reviewed. Go fucking pound sand. You bullshitters working for Big Pharma at the Washington Post. Dr. Jefferson did not answer our request for comment. He told healthcare commentator Marianne Damasi there's still no evidence that masks are effective during a pandemic, and because that's a fact. His remarks have been amplified in major news sources. But the Cochrane study has been criticized for several big flaws by fuckfaces and idiots who don't know how to read a study. People with an agenda have criticized it. A commentary published by the Center for Infectious Disease Research and Policy at the University of Minnesota noted that, and I'm sure they're not...
Wait, policy? What is that?
I don't know.
That's not researching disease. That's something about policy. I want to know what the hell that is.
Noted that it used the traditional definition of virus transmission through symptomatic coughing and sneezing that spreads larger droplets, and suggests it did not focus sufficiently on the key risks of small particle airborne transmission.
It would work less well for that.
It would work less well.
Oh my God.
This is garbage. I can see through this. The Cochrane authors also incorrectly combined studies where people wore masks or respirators infrequently with those where they were worn all the time. You mean real world consequences? You mean real world situations? That's what they used? How people actually wear masks? There has also been separate criticism of a Bangladesh study on masks that compromises more than half the population's data in the new trials examined by the Cochrane Review. Here is the bottom line. Really? The bottom line, according to the liars and dupes and fucking bought people at the Washington Post, bought by Big Pharma and the CIA and the military-industrial complex and Wall Street and big health insurance and anybody else you want to say, they've been bought by them.
Do you know who they are? That Center for Infectious Disease and Research Policy is a leading international collaborative effort to develop an influenza vaccines R&D roadmap.
Okay.
So it's some big pharma group.
Yes. Respirators are, so here is the bottom line. Loose-fitting face masks and surgical masks have a purpose. But when it comes to COVID transmission, they are like wearing goggles with holes. Respirators are far superior in a viral pandemic, given what is now clear about airborne particles. And do you have any data to back this up, asswipes?
If you stop being afraid about this, you might not get the great, safe, and effective vaccine. So we can't even take a risk of that. And I agree with the Center for Research, and I'm paid by Pfizer.
Wearing face masks, but especially respirators, in a crowded public enclosed space with poor ventilation is undoubtedly better than nothing.
Hey, rubbing prayer beads is probably better than not
better
doing
than nothing.
Like,
what?
You got faith. Anything.
Going like this is better than nothing. Just doing this to get the air away from you. Do this.
People who pray live longer, they say.
Yeah, it's better than doing nothing.
Wow.
They're just by the skin of their fingernails. They're still hanging on to this mask idea. A study by the Centers for Disease Control, you mean the CDC, concluded that consistently wearing a face mask or respirator in indoor public settings reduces the risk of acquiring... Oh, really?
The old one? The one before this one?
The one before this one.
Not real.
Yeah.
It's undoubtedly... No, the study says it is nothing. It's not undoubtedly better than nothing.
Yes,
it is nothing. Holy...
The pandemic has shown that the transmission route from one person to another is the air we breathe. Effective methods to block the virus, particularly respirators, are widely available. It is just a matter of they just go make it up.
There are no effective methods to block the virus.
There are no, if you are going to get COVID, everyone.
You know, you can slow it.
There's no getting out of getting COVID. This is all crazy. You're all in a cult.
Look,
this is what a cult looks like, and I guarantee you the people who wrote this don't believe it. I guarantee you the people who wrote this don't believe this.
I bet Taylor Lorenz believes it. Now,
here's how the people who believe this shit are liars. Ready? Watch this.
If I go on the subway, if I go in a bus, if I go into the theater, if I go into, where else would I?
So hang on, I'll play it again. Hang on.
If I go on the subway, if I go in a bus, if I go into the theater, if I go into, where else would I go?
Crowded spot.
A crowded place, I would wear a mask. And I might do that indefinitely. Because why do I need a flu or a cold even?
Right. That's
and so I'm listening to myself right now.
I'm listening to myself.
So she's
right
listening.
now?
So I'm going to tell her, let's break this down.
If I go on the subway, if I go in a bus, if I go into the theater,
you're in a theater right now, Joy. You're on a television set. You're in a theater right now. There's an audience of hundreds of people right there. There are people working all around you. There's 4 other people on that panel with you. Where's your mask?
Jimmy, because she's not by dirty poor people. She's with
That's
for
right.
other rich people. That's what she means. And also, I don't believe she goes on the bus
No kidding.
or the subway. So you won't be wearing a mask is what you're telling me, because you don't go in them things. And you're not wearing it in theater too.
She's in a theater right now, not wearing a mask. And then here she is in a restaurant the next day, not wearing a mask.
She means around non-celebrities, dude.
She's there with celebrities. She used to be on
Rhea Perlman. So it's safe. See, that's safe. Not these dirty kind of East Palestine train track people she doesn't like.
This is the kind of ethics and integrity and follow through these mask maniacs fucking have. Masking is a cult. COVID is a cult. And you're not allowed to say anything outside the cult.
If it weren't for the great vaccines we got out of it, the whole thing would be a wash.
Wow. They're still doing it. They're still clinging to it.
I saw that coming. New York's filled with germaphobe, like
Howard Stern's.
Yes, Howard Stern. The guy's got a special underground parking elevator for his car, so he doesn't have to touch anyone by accident on the way into work. And that's she has that the commoners. Hoo-hoo.
If I go on the subway, if I go in a bus, if I go into the theater, if I go into, where else would I go?
A crowded spot.
A crowded place, I would wear a mask. And I might do that indefinitely. Because why do I need a flu or a cold even?
Right. That's
and so I'm listening to myself right now.
So I'm going to go for the rest of my life without ever getting a cold or a flu. Has anyone ever said something that ridiculous before in history? Why do you think no one ever said that before? Because that's mental. Well, that's why that's mental. They never told elderly people who they tell to get the flu shot every year. They don't tell them, and wear a mask and don't go anywhere. They never do that.
She's listening to herself, Jimmy, and I can't think of a better person to listen to.
You're going to get a cold. You're going to get a flu. You're going to get COVID. Get ready. How about you lose some weight? How about you take some vitamins? How about you get in shape?
I've been sent home from a writer's room because I sneezed. And they're, I can't get sick. You got to go. Orny, we're going to jump 5 feet because I didn't uncover my mouth. Like that. He goes, this has been a thing forever.
You're kidding.
They all think they're not going to get, most of the, in fact, come to think of it, most of the real kind of names or people they are like that.
Yes.
God, I'm going to get
You're going to get a flu twice every decade.
One, I won't be productive. That's the main other fear. And then one, it's I have to become sick.
So if you look it up, adults get a flu twice every decade. So no matter what you do, you're going to get the flu twice a decade. No matter what you do, you're going to get COVID. Unless you want to sit in a closet by yourself with a respirator, then you don't get to have a life. But she wants to have a life, which is why she doesn't. She's a bullshitter. She's a virtue signaling bullshitter who's part of a cult. If you want to see my stand-up special, become a member at jimmydore.com. It's only $10, and come see our live stand-up comedy in Los Angeles, Palm Springs, Milwaukee, St. Paul, Honolulu, Northampton, Massachusetts, Syracuse, Cohoes, New York, Hartford, and more.